So we see this sort of top-down mentality coming out of Washington saying, here's how we're going to make medicine so much more efficient. And they change things they really don't understand what they're changing. Another thing that they're sort of emphasizing is sort of the well-being of the patient, which, of course, is what I want. And one of the ways they're doing it is they're empowering patients, which I want as well, but we do it two very different ways. What they've started doing now is tying reimbursement to the hospitals to patient satisfaction scores. There's something called a Press-Ganey score, where we get patient surveys at the end. And depending on the score, that determines the level of reimbursement the hospital gets. The problem is when you structure the system that way, it gives this disproportionate relationship, and it's taking the patient-physician relationship out of context. We're now in emergency rooms to achieve the proper Press-Ganey score, which in turn hospitals sometimes use to determine the salary of the physician. The emergency room physician knows that somebody come in seeking drugs. If they say no and don't give them the narcotics, they'll get a bad Press-Ganey score. So what ER physicians are beginning to do is simply hand out narcotics to get good scores from their patients, to get more reimbursement from Washington so they can keep their salaries. So this is fueling a system where we're dumping narcotics on the streets because the physicians can no longer be a physician. They're simply a technocrat checking boxes. And this has fundamentally changed that patient-physician relationship, and no wonder 40% of docs are thinking about leaving medicine.